Hey, it's been a while since I've updated, so I just wanted to make a quick update. Um, I stopped taking. This is a big thing happened. I should have probably made an update because it was pretty big. I stopped taking Humira October 2nd. I ran into some insurance issues after moving down here for school, down to California for school from Washington State. And everything was going fine in the beginning, but then after that switch, things got screwed up. Um, and I was off Humira for like a month to 2 months, something like that. 2 months actually. Um, and prior to that, I made videos very intermittently because I was in remission. My ankylosing spondylitis was in remission for 2 years. I think I was looking at it. I think I had started in November of 2017 or something. I'll have to look back, but it had been like 2 years, pain-free, everything. So I had to stop taking it because of that, the insurance issues, unfortunately. And then I got back on it after finding a doctor here down in California, fixing those insurance issues. I got back on Humira. This time they gave me the syringe. That's besides the point because before I was using a pen, and the syringe is like it's like you can see the needle and everything, and you have to actually physically inject it, physically poke yourself, and push the syringe in. It's just like a syringe that you use to clean out your nose or you clear out your ears with, but it has the medication and it has a sharp needle. And I'm not really scared for needles, so I didn't really care. That's actually not besides the point because that has nothing to do with the story. Basically, I got back on the Humira and it didn't work. So it had worked for 2 years and it stopped working after getting off of it for 2 months and restarting it. So it's really important to stay on the medications if they're working. You don't really want to take a drug holiday. I think that's what they call it. It's pretty funny, actually. Just like a drug holiday where you stop taking the drug. And the reason being is this can happen for any number of reasons. This can happen even when you're taking the medication consistently. But it was funny because I got a question because I'm like, I think I've mentioned this before, I'm in medical school. So I'm studying for my boards right now. So I've been extremely busy. But you can develop resistance to the drug. So I've actually been in pain and stiff and have been experiencing stiffness since October 2nd. So it's been like 6 months. But when I don't consider myself a veteran, but I've had it long enough. I've had it since I was 17. What am I, 24 now? It's been 7 years. About half of that time I was on medication, probably less than half of that time, probably 2 years, 2.5 years total. I was on medication about 2.5 out of this. So I know how to kind of deal with it. It sucks. Ibuprofen's been my best friend, but unfortunately I don't like taking ibuprofen, but I have to right now because it can cause liver problems, kidney problems, number of different things. It's not really it's not the best thing. You really have to, discuss it with your doctor and have your labs followed closely if you're going to take that long term. But for the last 6 months I've been taking that, just it's an insane dose, about 3,000 milligrams a day, 2,500 probably, actually not 3,000. And I think the max dose is like, I don't want to say it because I don't want to get quoted on it, but I think it's close to that amount. So I've been like killing my liver taking that medication for subpar relief, just to kind of get through the day. I can still kind of lift. I do like some weights just to kind of stay in shape. Can't run. No long-term cardio stuff, long distance cardio stuff. So that's been rough because I really like to be active. And so basically going back to my story, I always do this in my head. I've planned these videos before, so my thoughts are all over the place. But basically what happened with the Humira is I was off of it for a month and a half, and I developed resistance to it. I mentioned that while I've been studying for my boards, I got a question on it. It's a patient who had Crohn's disease and they were taking Humira. The patient was on it for a year, and then the medication stopped working after a year. It's a common story. That's actually the biggest reason for people to stop Biologics, if I remember reading correctly, it's because the medication stopped working. And that's because patients develop resistance to the medications. And it's something like, since Humira, adalimumab, like golimumab is the medication that I'm going to get into. Golimumab, infliximab, they're ab medications. So that means that they're an antibody. They're I don't know if they're mixed with an animal product or if they're completely humanized, but they're an antibody that binds to TNF, which is a protein that the body creates to mediate inflammation. And the antibody binds to that, gets rid of the TNF, whoop-de-doo, most cases. But what happens is sometimes, and this is why people, they stop the medication a lot of the times, their body ends up developing antibodies to the medication itself. So it starts taking out the antibodies to the TNF. So the TNF is running free, and your antibodies that your body's created is attacking the medication. So basically, the medication's not working at all. And in my case, the medication was actually making it worse. It has to do with immunology and a lot of in-depth stuff, and I don't really want to get into that, but it was making the inflammation worse. I was actually worse when I restarted my Humira. I noticed when I would do it for a while I was doing it like once a week, which is not recommended. I think it's once every 2 weeks. I think in some cases they prescribe it once a week for Crohn's. I'm not completely sure, but anywho, it's once every 2 weeks. And I noticed that that didn't help, and my pain was just getting worse. It was so bad. Like, I was taking like 3,200 milligrams of ibuprofen at the time. It was the worst. It was probably as bad as when I first got ankylosing spondylitis when I was 17, that initial bout. And I noticed 2 times when I waited 3 weeks to inject, which is roughly around the time when you start, seeing Humira leave your system. My symptoms actually got better. So I was actually doing better without the medication. And then I would inject. I did it twice just because I wanted to make sure, and I got worse. And just going through that twice was bad, but it confirmed it for me. So I stopped the medication. And I just went medication free. I've been taking ibuprofen. Been kind of getting through the day. It's kind of bad because I didn't notice this in the past, but I think I get costochondritis, which basically means you get inflammation around the joints of your ribs that connect to your sternum, and it's your costochondral joints, and then there's costosternal joints, 2 different joints, wherever you get inflammation in that area. So it's been actually, sometimes during that time, it was very difficult to even breathe. Like, it was difficult to take a deep breath in, and sneezing was not possible. I would try to hold in my sneezing. I wouldn't cough. Right now, especially towards the end of the night, if I don't take any ibuprofen, I don't want to sneeze. I don't want to cough still. It sucks. I can kind of breathe in, but it's not the best. So, kind of sucks. And that brings me into my update. So, I saw my rheumatologist, discussed all this with her, and she started me on a medication called golimumab. It's relatively new. It's newer than Humira. It's newer than Enbrel and etanercept, or whatever it's called. Simponi golimumab. Golimumab is the generic name for it. Simponi is I think is the brand name. So I just took my injection today, and wow, like, I was actually so confused when I took it because, for one, the pen's larger. I was like, oh, that wasn't the confusing part, but when I took it, I was like, wow. I clicked the button. I didn't feel anything. It was my first injection. We'll see with more to come, but I didn't feel anything. Nothing. And I was like, I was so worried, and when I picked it up, I didn't see anything. Like, there was a little tiny dot. That was it. And I was worried. I'm like, did the medication go all the way in? I read the directions. The yellow bar is supposed to be halfway. This is a window, and it's supposed to cover half the window. And I was like, it's doing that, and I couldn't move it. I'm like, what? I didn't feel anything. So that was pleasant, because even when I was taking Enbrel, when I was taking Humira, I would experience significant burning on the injection, which I knew it's a slight little nuisance, but I think my opinion, it's well worth it because, of the effects that you get with the medications. But this was a pleasant surprise, and I didn't feel anything. So this is a monthly medication. It's taken every month, once a month, whereas Humira was once every 2 weeks, and then Enbrel was once every week, yeah. And then I think the higher up from this, not that it's better, but in terms of lengthwise, is infliximab. It's like every 6 weeks, if I remember correctly. I'm not completely sure. So yeah, I'll keep you guys updated. This is kind of, I think I said at the beginning I was going to keep this short. This is not short. I realized that I had more to talk about, but I'll keep you guys updated. This is my first injection for golimumab. I really hope that this one works. First of all, I hope it works, and I hope I can stick with it long term and not run into any issues, because I like to think that if I hadn't run into those insurance issues, I would be completely fine and I'd still be using Humira. But what can you do, right? Thank you.